Immunotherapies have had a terrible impact on different cancer types, for example melanoma and non-small cell lung cancer. And obviously the question is, what is the role of immunotherapies in the field of colorectal cancer? And I think we have seen last year already some pretty promising data on microsatellite instable colorectal cancer. At this year's ESMO GI in Barcelona, we've seen an update of this data. We've seen some nice summaries. And I think there are some conclusions we can draw from these data. On one hand, for microsatellite instable colorectal cancer, response rate, at least the published ones, are pretty high, perhaps even above 60%. And there are some first trials running in the first-line setting. So I think we're going to see these drugs in the clinic pretty soon, also in routine use probably. On the other hand, there are microsatellite stable colorectal cancers. And using isolated immunotherapies has not brought significant responses in this field. There have been no responses of microsatellite stable colorectal cancer with isolated anti-PD-1 antibodies, for example. It's therefore very interesting to have new data on combination of MEK inhibitors and PD-L1 inhibitors. And for the first time we actually saw responses in microsatellite stable colorectal cancer. The response rate was around 17%, which is not tremendous, but at least opens a window of opportunity for immunotherapies in colorectal cancer. It's foreseen to start a phase 3 trial combining PD-L1 inhibitors and MEK inhibitors, and I'm looking forward to see these data probably within the next 2 years. I think the most important thing is immunotherapies have not yet made their way into routine praxis. They will probably soon make their way into microsatellite instable colorectal cancer, and it will take definitely more time for microsatellite stable colorectal cancer to benefit from immunotherapies.